Over 1 million American women are currently living with atrial fibrillation, or AFib. It's a heart rhythm disorder that can lead to life-threatening conditions. Dr. Annabelle Vogtman, she's a member of Women's Heart Scientific Advisory Council. She joins us this morning to discuss everything you need to know about AFib, from symptoms to risk factors. Good morning, Dr. Vogtman.
Good morning, Stephanie. Nice to be here.
Tell everybody what AFib is and how many people are affected by it. I know it's a lot. We talked about in the millions.
So atrial fibrillation is an irregular rhythm of the heart that can lead to strokes and heart failure, and there are so many people living with atrial fibrillation. About 33 million worldwide and 8 million people in the United States have atrial fibrillation. About half of them are women, so it's extremely important for women and men to understand the risk of atrial fibrillation, and that is why WomenHeart started, an organization of women with heart disease started to launch a virtual support network for women with atrial fibrillation and their caregivers, to give them the education and the emotional support that these women need when they're living with atrial fibrillation, so they can lead healthier and better lives.
Now, what are some of the symptoms and risk factors that we should be paying attention to?
So the risk factors are aging. People who are older tend to get atrial fibrillation and are higher risk for stroke when they're older. So especially for older people, they need to know what their risk of having atrial fibrillation is. The other things that can cause atrial fibrillation are high blood pressure, obesity, sleep apnea, alcohol. If people have too many drinks and they feel palpitations, they should really cut back on their alcohol, and if they keep having too many of them, they should go to their healthcare provider to try to get it diagnosed. Some people just feel palpitations, fluttering in their chest, or flip-flopping in their chest, but some people can just have shortness of breath or fatigue, and they can have atrial fibrillation with those symptoms.
And I know women are at higher risk. Is there support for women who are living with AFib?
So right now we're launching this, starting this month, we're launching, the WomenHeart organization is launching a virtual support group, and they can log on to womenheart.org. They can register right now, and they can be part of support network, which is run by WomenHeart champions, women with atrial fibrillation, who have been trained and educated to help women with atrial fibrillation to know what to do and what the symptoms are and how they can get help for these women and the caregivers. And there are physicians who will also be online who can help them answer their questions.
And speaking of caregivers, as we close here, Dr. Vogtman, why is the caregiver such an important role in helping women understand and really just manage that condition?
What we found is that women with atrial fibrillation need a lot of support because they have a lot of anxiety. They need help with the medications, and it really helps them take better care of themselves. But the caregivers need to be educated and trained to help these women with atrial fibrillation take their medications, live a healthier life so that they don't get the symptoms or the recurrences of atrial fibrillation.
And if you could just give us that website one more time so that we can make sure anyone who is living with AFib or is at risk can certainly take advantage of this resource.
And learn more from WomenHeart.org.
All right, thank you so much. We're also going to have more on our website.
Thank you,
can
Stephanie.
check out fox4morningblend.com.